Alcohol misuse can have a huge impact on people's health, but also causes a big strain on hospital A&E departments. Spectrum Community Health CIC has developed a hospital-based alcohol liaison service which benefits patients, staff and the wider community. Sharon Thomas went to meet the team.
Life is so good now. I'm so pleased to be here. Life's wonderful.
At her lowest ebb, Fiona Edwards was drinking 3 bottles of wine a day. She has a family, a job, a home, and nearly lost it all to alcohol.
I was an alcoholic. I was drinking far, far too much. And I ended up in hospital twice, and then I just carried on drinking. Totally ruined my life. I was unconscious for 2 days in hospital, and then a doctor came to me and said, if you don't stop drinking, you'll end up dead. And a light went on.
Hello, Fiona.
Hello.
Take a seat. How are you?
Thank you.
After the 3rd time Fiona presented at Pinderfields Hospital's A&E department in Wakefield, she was referred to Spectrum Community Health's Alcohol Liaison Service, or ALS.
Having that shoulder to lean on, just being able to come in once a week and chat about how things are going. And they've just helped me so much. I couldn't have done it without them. It's been brilliant.
Patients who present at A&E with alcohol-related issues are referred to the ALS, a team of 2 Spectrum nurses who work with the patient to plan a programme of care. The service offers one-to-one support, which helps patients to explore their relationship with alcohol and work towards positive change.
It's life-changing for these people. A lot of these people don't know where to turn. They turn up to hospital, maybe their last hope for help. We listen to them, we listen to the family, because obviously the family are at the end of their tether as well. We are here to give them that hope that there is life after alcohol.
And when people would reach for water, I'd be reaching for wine.
Patrick used to drink around the clock, sometimes 5 bottles of wine a day. It almost cost him his life.
Eventually it kind of caught up with me. It got so bad that I slipped into a coma. When I came to, they gave me about a 50% chance of actually pulling through. They let my immediate family know, and they kind of feared the worst, really.
The ALS nurses were Patrick's lifeline.
I think I would have found it a lot harder if it wasn't for them. They do offer a really great service. The thing that really shines for them is that they're very, very patient with people. And even when people don't want to listen to their advice, they're absolutely amazing.
Here in Wakefield, the number of alcohol-related hospital admissions has fallen by more than 1/3 over the last 4 years, largely due to this service. It's estimated that saved the local NHS trust around £1.5 million. Spectrum service supports the essential work of the hospital staff.
Previously, when there was no alcohol liaison service, patients presented with alcohol-related problems and had no clear pathway to get the care they needed. Now, when they present, they can go home safely with alcohol liaison service, seeing them at home and telephoning them, or they can be admitted for a shorter period of time where they get the help they need and support once discharged.
The head of the social enterprise that was commissioned to set up and deliver the service says having alcohol liaison nurses within a hospital setting is an essential bridge between the acute setting and the community.
I'm enormously proud of this service. It represents the best in partnership working. Spectrum, working with Mid Yorkshire Hospitals Trust. It's about bringing the skills and competencies of the A&E staff together with the community alcohol treatment nurses. That means better outcomes for patients. It also means seamless care, because patients are moving seamlessly from the hospital discharged into the community.
Fiona has just celebrated her 60th birthday, a day she thought she'd never see. Both she and Patrick have been alcohol-free for a year.
They have helped me enormously, without a shadow of a doubt.
The nurses, without them, I couldn't have done it. They've just been absolutely fantastic.